I am Dr. John Ofenloch, the Director of the Cardiothoracic Surgical Program at the Morgan Heart Center of Morton Plant Hospital. The Cardiothoracic Program at Morton Plant Hospital is really a multidisciplinary team that works to provide the best possible care for patients regarding diseases of the heart and lungs. The Morgan Heart Hospital is one of the busiest and largest cardiothoracic surgical programs in Florida. It's certainly the largest program in the region, and we've been able to maintain our excellent outcomes and volumes by focusing on new lines of service and innovative heart care. The cardiothoracic surgery program at the Morgan Heart Hospital is unique because of the collaboration that we provide. The team, including the cardiologists and the surgeons, as well as the nurses, the respiratory therapists, all work toward the same goal. In fact, our universal bed concept allows patients to utilize one hospital room and bed while they're in the hospital for their care. They're admitted to the same bed that they're discharged from, and the level of care that the patient requires, it changes based on what the patient needs rather than where the patient is in the hospital. The collaboration has allowed us to maintain a core of excellent nurses and other support staff that provide consistent care to a large number of patients. Patients should certainly think about the reputation of the hospital when they're considering locations for cardiac and thoracic surgical care. The reputation of the hospital is not just word of mouth, but it's also what's available now on the internet. The heart program at Morton Plant Hospital participates in a number of databases which allow for public reporting of our outcomes and data. Certainly, family members are encouraged to seek out this information prior to making decisions about where they would like to have their cardiac procedures performed. Patients should also consider the expertise and the experience of the surgical team, and they should consider whether the proposed procedure is the best fit for them and would enable them to have a full recovery locally. I would recommend the heart program at Morton Plant Hospital because of the expertise and the experience that the entire team has in treating patients with cardiac disease, from the surgeons to the cardiologists to the nursing staff and the consultants. The expertise at Morton Plant Hospital has produced outstanding results year after year. We've been able to maintain a large volume practice with a group that's focused on innovation and providing outstanding care for the community. Our cardiothoracic surgery program typically performs between 500 and 600 open heart procedures each year. This includes operations for coronary artery disease as well as operations for valvular heart disease, including aortic and mitral procedures. We typically perform between 100 and 150 thoracic operations, which are procedures which are performed for the treatment of lung cancer and diseases of the lungs. We have performed over 150 transcatheter aortic valve procedures. Patients should definitely consider more than just the convenience or the location of a hospital when deciding where they would like to have complex cardiovascular care delivered. It's one thing to be able to drive around the corner to visit your family, but it's another thing to know that they're well taken care of at a center that receives statewide and regional referrals for complex cardiovascular patients.